Hello, everyone. Hello, all of those of you who I saw last week for the first one in this series, and hello to all the new faces. My name is Mary Jane, and I'm going to be presenting today about other language access topics, which I'm going to show you in just one sec. So welcome, and thank you for being here. Here we go. So as Anthony said, this is the second in our September series for Language Access Fundamentals. And I will say from the very beginning that we're going to be introducing some pretty basic topics in language access, as well as, some conversations about institutional fluency and how you can bring some of this work to your own organizations. It might be a little advanced for some people. It might not be advanced enough for others. It's just kind of the basics, but, with the added benefit of all of us maybe talking to each other a little bit and hopefully some information that's new and helpful for all of you. Just to do a very brief bio of myself, my name is Mary Jane McCullough. I was a translator interpreter myself for about 15 years in the field. And then I founded an organization called Global Wordsmiths that provides translations and interpretation in 2017 to help advance language accessibility and advocate for language accessibility, located here in Pittsburgh. I'm also an adjunct professor of translation technologies and applied translation at Carnegie Mellon University and a commissioner on the Pittsburgh Commission on Human Relations. I serve on the board of directors of the Alliance for Refugee Youth Support and Education, and just in general, I kind of get to live and breathe language access as my career, which is really lucky because I'm very passionate about this work, and it's something that I love to do. So I hope that my knowledge can be helpful to you all. And today specifically, we're going to be talking about some practical skills. So we talked last week about defining language access, like what language access is, why it's so important, what it means to people in their daily lives. And this week, we're going to talk about identifying different tools and understanding who should and should not be used as an interpreter, and then how to effectively use the language assistance resources that we learned about last week. We're also going to learn a little bit about how to do that in a culturally appropriate manner, and these are things like having some etiquette, introducing yourself and speaking directly to the subject and not the interpreter, who to make eye contact with, where to sit, etc. So just to remind you, as a brief refresher, the primary language assistance resources that you will be using to communicate with people are going to be phone interpretation, which in the industry is called OPI. It's a silly name, but that's just what they call it. So telephonic interpretation, or if you're talking to an industry person, OPI, video remote interpretation. So that would be a live interpreter that you interact with via video, places like Zoom or Microsoft Teams, Google Meet, etc. In-person or on-site interpretation, which is kind of the gold standard, and then written translation. There are more language assistance resources, and even within these language assistance resources, there are different modalities, different kind of subgenres and things and domains that you can work with. But for most of you guys, just understanding the differences between these is going to be enough for you to start getting out there and communicating with people. This is also a really good point to remind folks, because we do see a lot of people passionate about this work who want to help, that interpretation and translation skills actually take years of training and experience to develop. So a lot of the times people will conflate translation and interpretation. We learned last week that they're different disciplines. They're totally different fields. Interpretation is oral or signed, and translation is written. And being bilingual doesn't necessarily make you good at either one of those things. I train a lot of interpreters, and what I always tell them is that there are millions of people in the world who are bilingual, and that's amazing. And being bilingual is an incredible skill. However, being bilingual alone is not the same thing as being a trained interpreter or being a translator. And all the little things that interpreters and professional translators do to convey meaning correctly in a culturally appropriate way, body language, where they physically position themselves if they're interpreting live, practicing, managing people's expectations, being able to identify cultural issues in real time, those are all things that take a lot of skill and a lot of training. And so the reason I bring that up is because I think a lot of people who want to help and a lot of people in positions of leadership will use children or community members or bilingual volunteers, bilingual staff members to help with interpretation or translation. And that's okay sometimes. We talked last week also about language access being a holistic toolkit where you have lots of different tools that can be used at appropriate times. And certainly bilingual volunteers and people can and should be used in certain circumstances. But for anything important or vital, anytime somebody's anytime somebody's civil rights are involved, which is their right for to have equitable access to resources, information, and services, you want to make sure that you're using trained professionals, because if not, it's not equity, right? People who are not trained might not convey the entire meaning of something. They might withhold information for a number of reasons. They might not understand the information and therefore interpret it or translate it incorrectly. There are a whole bunch of things that can go wrong when you do use people who are untrained. And this actually takes agency away from the subject, because then what ends up happening is these well-meaning volunteers will end up speaking on behalf of the subjects rather than truly interpreting what's being said. And even if they're trying to help, that's not really the purpose of language assistance, right? The purpose of language assistance is to facilitate communication, to help somebody use their own voice rather than speaking on their behalf. And I think with language access, it's really easy, even for well-meaning advocates, for us to kind of slip into the trope of wanting to help, but then accidentally overstepping and taking over or speaking on behalf of somebody, and even thinking of somebody as needing to be saved or needing to be helped, when really these are capable human beings who just need and deserve equitable access. So language assistance resources exist to provide that. Interpreters are not there to be caseworkers. Interpreters are not there to be advocates, though many of us do advocate in our free time. The best way that we can help using our skills is to interpret accurately and completely and within the best practices and the ethical standards of the interpretation and translation field, so that the person we're interpreting for truly has that equitable access. So I'm going to get down off my soapbox now and talk a little bit more about that. I like to call bilingual folks who want to help but who are maybe not trained bilingual helpers. And these can be family members, community members, friends, local business owners or community leaders, bilingual staff members who have not been formally trained, volunteers who have not been formally trained, and other ad hoc interpreters who happen to be there, who speak both languages, and who are maybe asked to help in a situation. And bilingual helpers, again, are awesome. And they can help people identify languages. They can help keep people calm in emergency situations until professional interpreters arrive. They can help in a number of ways. But again, if you're dealing with in government or public policy, providing services to people who do not communicate in English, and you are a recipient of any federal funding, the mandate is to provide equitable access, and that would be through a trained individual who will equitably and completely convey the message that's being transferred without any bias and without any personal involvement, right? So family members, in this case, come up a lot, and I get asked this question a lot because many people feel most comfortable having their family members interpret for them. And this can be problematic for a number of reasons. A few of them might be that the family members can become emotionally distressed and become overly involved. And that can really affect their ability to be accurate and complete, because then they'll end up kind of like filling it in with their own biases. And that's even something that's hard for trained interpreters not to do. It's really hard for us not to get in there and help and get involved, right? We have to sort of hold ourselves back. And family members who are emotionally invested don't have those skills. Family members also aren't trained, and they might not understand some of the terminology used. And so when that happens, they won't know what to do or how to clarify information. They might just take their best guess and interpret based on what they think they've comprehended. And that's also not providing equitable access to the information for the subject. And then, of course, there's bias and conflict. Using children especially becomes a problem because, there's not a lot of privacy for the subject, and children just aren't intellectually and emotionally developed fully enough to really maybe be put into this role. And there are lots of other ethical and, best practices reasons. But, I'm also here to tell you that if you have been using family members and bilingual helpers, it's not my job to stand here and tell you that you're doing something wrong or you're doing it incorrectly. It's just my job to say, we can only act based on the information we have. And this work is really new to all of us. So it's not that, you're doing anything particularly wrong. It's just that, we can start where we are and use this information to make better choices moving forward and do language access together, because this is new for all of us and it's hard. So I just want to be clear about that it's never my intention to make anybody feel bad about what they have or may not have been doing already. It's just to say, how can we all do this moving forward and continually improve? So at any rate, if somebody does say they don't want an interpreter because they want to use their family member, this is also a practical skill. I've found that many times with language access, the reason people don't engage in language access or don't do a lot of language access stuff is because it's really intimidating, right? Especially if you haven't had any training, have never been to a workshop like this, you're just kind of starting to work with migrant, immigrant, and refugee populations for the first time. It can feel really scary, like you're going to do it wrong and mess everything up. And so if somebody just says, I'm going to use my, son to interpret, the easy and best feeling thing to do is to say, sure, right? But developing the ability to say, actually, it's better for me if we have an interpreter, or I'm required to have an interpreter. I don't intend to say that you're not capable. It's just, it's the rules. Or you can say, my boss is really strict about this. I'm sorry, but I'm going to have to use an interpreter. You can kind of come up with a script and think about how you want to say to people, actually, I do need to have an interpreter here. And you can use your best judgment to decide if that's needed or not. But if it is needed, I recommend having a waiver prepared. Because if somebody just is adamant and they don't want to use an interpreter, that will protect you. And sometimes people also, if they see a waiver, they'll understand that they have a legal right to the interpreter, and they might change their mind and say, okay, I'll use an interpreter. But either way, it protects you and it lets them know what their rights are. You can also briefly explain the pitfalls of relying on family members. But if you absolutely have to use a family member or, rely on volunteers or people who aren't trained, just proceed with a lot of caution. Use very simple language and be vigilant for miscommunication. So, pay attention to whether or not they seem like they're understanding and connecting with the information. If people are kind of staring off into space and not really engaging with you, it might be a sign that they're not really understanding. And so then you can make the decision about trying again to see if they're interested or willing to use an interpreter. Remembering that when a person says they understand what you're saying, that might not be the case is also an important skill. This applies to both LEP or limited English proficient individuals and untrained bilingual helpers, right? A lot of the times somebody may be perfectly bilingual, but if they're asked to interpret, their ability to process that information might change. I teach applied translation at the graduate level at a technical university, and these are very bright, gifted students. And by the end of a 1.5 year long program, usually most of them still have red ink all over their translations because it's just a difficult job, right? So as leaders and as decision makers, it's really an important practical skill to have, to be able to identify, okay, language assistance resources are needed here, and then know which tools to use. So with that all being said, I think the meat of this and what a lot of people always really want to know about is like how to actually work with interpreters. And this is another reason why I think sometimes people don't want to engage with language access because it's hard. It's uncomfortable to communicate through an interpreter. And if you're doing it for the first time, there's really no way to know if you're doing it right. It can be hard and awkward to get feedback and understand if the interpreter interpreted everything you said. And there are just so many unknowns that I think it's natural that people might avoid wanting to use interpreters. But once you get the hang of it, it's just like any other skill. You practice, you use the information you have to do the best that you can. The more you do it, the easier it will get. So with that being said, because this is only an hour, of course, I can give you the very basics of all of this, but I could spend weeks talking about the ins and outs of this particular skill. But working with interpreters, the big ones are, you want to pause after each sentence to allow the subject to process the information, and of course, to give the interpreter time to interpret. You also want to ask only one question at a time, because if you say, it's just like with my kids, when I'm trying to get them out the door in the morning, I'm like, okay, clear your plate, put your shoes on, grab your backpack, go get in the car. It's too much for them, right? They can do one of those things, maybe. So you're just slowing it down. And that's not to compare people who don't communicate in English with children. It's just that all of us can only process so much information at the same time. And language is particularly difficult, right? Speaking in the first person is huge. And so this means making I statements rather than he, she statements. So you would say, for example, hi, my name is Mary Jane. You wouldn't say to the interpreter, tell her I said my name is Mary Jane. Or can you ask her to tell me, right? You would just say, can you tell me? And you would speak directly to the person as if the interpreter was not there. This is the standard for professional interpretation always, and it makes a huge difference. It saves time because there's not a ton of back and forth, like, adding all those extra words to every sentence does take actual time. It also avoids third person confusion. So if you said like, she sells seashells by the seashore, and nobody had the context, they might be like, well, who sells seashells by the seashore? Is it her, or is it him, or is it you? And if you just speak directly to somebody, that whole confusing element goes away. You also want to look at and interact directly with the subject. One of the big things I said during last week's training is that language access is access, right? Language access is respect. Language access is connection. There are a lot of things that get lost if you are looking at the interpreter, talking to the interpreter while the interpreter then conveys it to somebody else. You want to just, look somebody in the eye, treat them as a whole person, which I'm sure you already do, but it can be a little weird when you're using an interpreter if you're not used to it. And just, act as if the interpreter wasn't even in the room and let the interpreter do the job of managing everything that makes that difficult, right? Professional interpreters can do amazing things with being invisible and still facilitating communication. Some more practical skills would be, again, remember to speak always to the subject and not the interpreter at all times. Imagine, being in a doctor's office, for example, and the doctor's talking to the interpreter about you rather than looking at you and addressing you directly and talking to you, and what a huge difference that makes in the experience, right? And this is how one of the ways that untrained interpreters can really end up accidentally kind of taking agency away from people, because they'll get caught up in side conversations, with like the provider, or they'll end up in conversations about the person that don't get conveyed or communicated, and that ends up being very isolating for the subject. So always remember to talk directly to the person you're interpreting for. Interpreters should never answer questions on behalf of the subject. So that's something that, as providers, if you're working with an interpreter, keep an eye out for, right? Be vigilant. If you see the interpreter start to talk to the subject, or, answer questions, that you ask rather than interpreting the question, that's a big red flag. And you should call a timeout and say, hey, I need you to make sure you're interpreting these questions rather than asking them yourself. And, that can be the difference, again, between somebody feeling respected and feeling included and feeling like they have equitable access to somebody feeling isolated or left out or like they don't have full control over their own care or service. Allowing extra time for sessions that are going to require interpretation is also important. It can take up to twice as long. So if you are in the business of providing services and you need an interpreter for an intake session that takes 30 minutes usually, schedule a full hour for that because sometimes interpreters get lost and they can't find the door or they get the wrong room number. And then they're, is the issue of that like sort of text expansion where like you're talking and it takes twice as long to explain something and there's a lot of pausing. It can just take a really long time. You might not use the whole hour, but if your schedule is dependent on it, go ahead and schedule twice the time, especially if you're new to this work and just sort of learning these skills and practicing these skills. It's really important for the subjects to understand everything that's being said. So please use simplified language whenever possible. And this doesn't mean speaking to people like their children. It just means using plain language as you would if you were creating any kind of content to disseminate to any audience, especially those of you who are in government. I'm sure you're familiar with plain language requirements. And that just basically puts everything in an even playing field because it's really hard to determine in advance how much cultural understanding and context the subject is going to have about whatever service it is that you provide, how much they're going to be able to comprehend based on non-linguistic factors as well. And so the more you simplify things, eliminating acronyms, explaining things that might be unclear, the more likely it is that your message is going to be fully delivered. It does not help to speak more loudly, but it does help to slow it down a little bit. Another good tip is to set the scene if you're using OPI or telephonic interpreters. So this means when the interpreter gets on the phone, you say, hey, my name's Mary Jane. I'm in Pittsburgh today at a medical appointment with a new mom. The baby's been fussy and not sleeping, and she's very tired. And the baby is here in the room with us, and he's crying a lot, so it's kind of hard to hear. I just wanted to give you the context before we start the call. And even just that little bit of information will help the interpreter acclimate to the situation because when you're using phone or even video interpretation, a lot of that context gets lost, right? If we can't visually see you and be there and gauge, what's happening, then our ability to do our jobs effectively is really affected. So the more information you can give interpreters, the better. That also works for translations. If you're going to be requesting a translation from an agency or a freelancer, give them as much information as possible about the audience, about the purpose of your translation, right? About any special terminology that you want to be included and things like that. Okay. And then in terms of culturally appropriate technique, it's impossible to identify in one short workshop all of this symbolism, colors, words, and particulars that could be inappropriate or offensive in all of the different cultures that we work in. And so just very broadly, I would say just, use basic etiquette, right? If you're going into somebody's home, remove your shoes before you go in, act comfortable if somebody offers you food, accept it, right? Just kind of things that I feel like we all have a sense for. But if you don't know something, it's okay to ask. And it's okay to ask the interpreter. They're not there to be cultural experts and to teach cultural competence, but they can help you identify things that you should be doing or not doing in certain situations. And it's okay to ask them questions like that. But just in general and really broadly, introduce yourself to the person you're working with. Say hello to the subject, introduce them, shake their hand, look them in the eye, and then introduce the interpreter, right? I think a lot of the times people will introduce themselves to the interpreter and then walk into the room and start talking to a patient or a subject. And that can almost offset the power balance in a very subtle way, where the subject might feel like the interpreter and you or the speaker are like one unit and then they're another unit. But you want people to feel welcome and connected to you as the provider, right? And so always addressing them first if you can is the way to go. You also want to position your body so that you're facing the subject with the interpreter off to one side, right? I usually tell interpreters to sit closer to the subject because, again, no matter if you're an advocate or a grassroots community organization, a government provider, a doctor, there is a natural balance of power that happens when somebody's seeking services versus providing them. And so if you're an interpreter, even just the little act of sitting closer to the person can provide them with that extra little bit of support. And so having everybody there together and you're looking directly at somebody with open body language, the interpreter's off to the side, but they're there as a supportive person, can make somebody feel comfortable, less defensive, and kind of foster more trust in the relationship, even though it's just a short relationship. And then the big one is please don't have side conversations with the interpreter that do not include the subject. So it doesn't feel good for anybody if two people are speaking a language that they don't understand, in the same room or in the same situation. And you might not have bad intentions, but because they can't tell what you're saying, those side conversations can really make people withdraw and feel uncomfortable. So if you do need to ask the interpreter a question, a professional interpreter will interpret that rather than answering you and talking to you. But if some side conversations do accidentally happen, just make sure that those are being conveyed to the subject so that they don't feel left out. So those are some basics. And then we get into this kind of workshop, right? So one of the things I love about working with Welcoming America is Welcoming America's ability to convene so many people from so many different walks of life. And when we do these monthly workshops, we can all come together with a shared goal and have really meaningful conversations about this work. And we can use each other's experience to help shape our practices and to learn. So what I want to talk about today is organizational fluency or institutional fluency, some people call it. And this is the idea of, language access is new for a lot of us. And in a lot of the work that we do, a lot of us are building language access programs or running language access programs that are somewhat new, even if they're just within the last couple of years. And one of the biggest questions I get asked is, how do we make this work sustainable? How do we get other people in our organizations to buy into this work? How do we, continually have resources for this? How do we work this into the narrative so that just like any other service that we would provide, we have, a policy for this, we have operations for this, we have workflows for this. People know what to do. There's signage, there's clear policy, right? So I call that organizational or institutional fluency. And it's just the idea that people at different levels of your organization have roles and responsibilities with regard to language access. There is some operational framework for language access. Language access is a part of the narrative. There's a budget for it. And there's a way to move the work forward, whatever that might look like. And the budget line is particularly important because without a budget, it will always be an afterthought, right? So, who's going to designate that and how can you help ensure that happens? So I would like to propose that we hop out of these slides, and I'm going to put you all in breakout rooms together and have you workshop these questions together. So I will put them in the chat. I'll copy and paste them after I leave the sharing, but also please feel free to take a screenshot of them, and even take them back to your leadership or back to your organization and see if they can be helpful. But they are, how can you make sure that your staff has some basic training for how to work with interpreters and how to do whatever language access activities and work that you provide? How can you make sure they know how to do that? If you use the phone system, for example, do they have the PIN numbers and the number to call and the instructions for how to do it? If there's a PO process that they have to go through to request translations, is that clear? Is it a policy that exists? Is it written down? How can you make sure that people have this information and are trained? If you have bilingual folks who work within your organization, how can you make sure they're trained to interpret accurately and completely and within those best practices that we briefly talked about? How can you make sure that your vital materials, contracts, waivers, any kind of information about care, medical care, things like that, having those pre-translated into the languages that you're going to encounter is great because then you don't have to wait if you're offering services to somebody for a translation process. You can just give them the pre-translated, flyer or intake form or agreement or whatever it is. How will you provide notice to multilingual consumers that services are available? This is an important one because there are some provisions in Title VI about providing notice. That's one of the requirements, is that you have to have a mechanism to tell people, if you're a recipient of federal funding and this applies to you, that language access is available at no cost. So how will you do that, right? Will you put it on your website? Will you put signs in your window that have multilingual taglines? Will you use visual aids to convey the information? How will you make sure that you have a contract in place with a language services provider, right? You don't want to be last minute, oh, we just got a translation request, or we have a family or a patient or a person who needs, Spanish translations, but we don't have anything in place. Then you'll be scrambling to find somebody who can do a translation, and having a contract in advance with a provider that you trust and that has been vetted will make that all go really smoothly. Who will designate the budget line? How can you help ensure that happens, and whatever your role is? And then how will you make language access a part of the regular narrative? And this is really important. So full disclosure, I am a member of the disability community. I don't take it lightly to compare the two. I don't think that language fluency is the same thing as physical or cognitive disability in any way. But if you look at disability infrastructure, disability accessibility infrastructure, and language access infrastructure, the Americans with Disabilities Act was new, I think, in 1991. And we were having these conversations about how to build accessible infrastructure for all manner of things, 20 years ago or 30 years ago, I guess, in that context, right like we are now. And now, 30 years later, ADA accessibility and provisions are part of our culture. They're part of our narrative. There are entire industries around it. If you go into a hospital or any kind of a provider, there are accommodations, and it's something that most people know a reasonable amount about, or at least think about in their work. But we don't have that same level of narrative around language access, which makes sense because it's newer to most of us, but it's always been vital and important. And how we can advance that through our work and in our organizations is going to be really important to the future of how we grow into this together as a culture overall. So that's my soapbox and presentation portion of today. I'm going to stop these slides, and I believe these will be made available for people if anybody wants them. But I'm going to go ahead and see. We've got 26 participants. So I'm going to go ahead and set up breakout rooms of 3 people for the next 10 minutes or 15 minutes and let you guys work together to think about these questions. And then we'll come back, and hopefully some people will be willing to share some of their answers and information so that we can all learn from each other. Welcome back, everybody. I hope you all had nice conversations with each other about this, and got to meet some new people. So I'm going to actually scroll up while you were all in your breakout rooms. I noticed a question in the chat. Could you speak a little bit about boundaries when a bilingual helper is communicating in language? So a bilingual Spanish speaking staff member, not an interpreter, speaking to somebody in Spanish. That's a really great question. So in language service, as we call it in hyphen language, is direct service provided by somebody who speaks the language. And so an interpreter is not required. And in that case, they would just behave as, with the subject as they would with any other person in any other language. So if they are, for example, a customer service representative and they answer the phone and, they're English speaking and an English speaker calls in, they would do their jobs as they normally would. And then if they also happen to be bilingual and speak Spanish and a Spanish speaker were to call and they were to take that call, they would just proceed as they would normally, just in Spanish instead of in English. So in terms of like boundaries, anytime they're providing direct service, they would just need to be qualified to do that, right? Otherwise, it would be something a little bit different from direct service, even if it's not quite interpretation. And that would really just depend kind of, I think, on the example. So that was from the Q&A field, which I don't actually know how to use. So if anybody has any comments or additional questions on that, just let me know. You can raise your hand, you can put it in the group chat, or you can use the Q&A field. And Anthony, I guess if you don't mind keeping an eye on that. So
Actually, I'll interrupt really
oh yeah,
quickly just to share.
yeah.
Earlier, when you were talking about some of the different scenarios there, we had a comment from Eli that said you made a really good point. He said that not setting the scene for phone interpreters is a common
Mm.
issue that he's experienced with service providers. So that was a really good point that you brought up there.
Yeah, thanks for that comment. I think it is something that we don't think about really about how much context we get visually, and even through body language and things like, being able to see people's facial expressions and kind of read between the lines. There's a lot of implicature and like fun linguistic stuff that happens non-linguistically, a lot of communication that takes place that phone interpreters just don't have access to. I see there's actually somebody with their hand up. So, Lorna from Virginia Works, you have a question?
Yes, I do have a question. I just want to
Yeah.
let you know I really enjoyed this workshop so far. I met Zaina, who is also her English is also her second language, just like mine. So, my question is, I know you train interpreters, so I have actually an experience in the past where I'm assisting an LEP individual, and this interpreter is actually injecting it's kind of like his opinions about what was going on. So it's primarily the conversations about unemployment and how we're running out of funds and things like that. So the interpreter was like, well, it's been 6 months, you haven't had or found another job. So that's when I, kind of like, okay, well, time out. Remember where you need to be an unbiased,
Yeah.
person in this process, and the goal is to actually, obviously assist and find out what the customer needed, and not to kind of lecture. So I ended up kind of reporting it to our interpreting service people,
Good.
so they can actually kind of like maybe remind them of their main role in the process.
That's a really good example of how untrained people can sometimes really disenfranchise non-English speakers in the process, whether they're from an agency or they're volunteers. Just not conveying the meeting and getting involved personally really has a huge effect on the communication. And I can say, as an agency, as somebody who's trained a million interpreters, most agencies do not train interpreters very thoroughly because interpreters are generally independent contractors and they will move on to full-time jobs a lot. And so a lot of companies are very hesitant to pay them fair wages and to really take the time and resources to train people thoroughly and try to retain them. So there's a lot of turnover and a lot of interpreters that are just new or just kind of bilingual people that they get at the last minute. A lot of interpreting agencies don't even exist in the cities that they serve. And phone interpretation especially is great at this because people are getting paid pennies on the dollar. They're taking calls. They just have an app on their phone and they can turn it on when they want to accept calls, turn it off when they don't. You do it to make extra money, but they're making, literally pennies on the dollar. And sometimes people answer the phone while they're in the grocery store or while they're driving and they're distracted. So there are a lot of quality control issues. And I will say, even if you're an agency and you do train your interpreters thoroughly and work with them, sometimes in some cultures, you're working with individuals who haven't had the same access to education and opportunity as some other interpreters might. And so they require more training and more practice than other people to really get it right. And as an agency, they should be careful about not sending folks like that, to a courtroom or to a medical appointment, for example, because it's hard not to get involved. It's really hard. And no matter how many times you tell somebody or train somebody to maintain those boundaries, it's still something, especially culturally, that not everybody's able to do. So as providers, the fact that you reported it and that you brought it up and that you recognized that it was incorrect is great. And that's a great example of exactly how to react. I mean, agencies would probably want to know that this was happening, right? To either provide more training for the individual or terminate their contract, or just figure out how to make sure that never happens again. So if you see something like that, all of you definitely speak up, complain about it, and in the moment, stop them and say, "Hey, this isn't what you're here for. We need you to just interpret objectively and not inject your opinion." So thank you for that.
Thank you.
Yeah. Is it Irene or Irene?
It is Irene. Thank you.
Sure, Irene, you have a question?
Sorry, I have a bug. That's why I did that.
Oh, no problem.
So I have a bit of experience in language access, and actually was trained as a licensed interpreter trainer. But I worked for Welcome in America and used to work also in city government before joining Welcome in America. So long story short, two things. One thing is I've noticed a lot of the information that you covered is very familiar to me, coming from the medical interpretation field. And so I was wondering, I work in the certification program where we work with city governments and their language access, policies and work. So my question is, are there practices, codes of ethics that you have noticed specific to more of the government field, which I don't know if it would be semi-legal, legal, community. I'm not sure what the industry would call that, or if it's just government. And so that's one question: is there something I should be aware of in terms of the specific sector of interpreting in government? And yeah, I think I'll just start with that.
Yeah, that's a great question. So as Irene pointed out, there's a code of ethics that interpreters are all trained under, trained interpreters, and this varies slightly across domains. So medical interpreters, focus a lot more attention and energy than community interpreters, for example, on the confidentiality piece and on the accuracy and completeness, because everything is so important. But all of those ethical kind of tenets of the profession apply. So whereas a medical interpreter might take extra classes or spend extra time learning about HIPAA and learning about, different privacy practices and data security and confidentiality to a really specific standard and degree, community interpreters still abide by those ethical tenets. So they are still mindful of confidentiality and privacy, and that's still a core ethical standard, but they might not focus on it as much in their training. Or, for example, in legal domains, there's a lot of specific terminology that they might spend more time studying than somebody in a different domain would. And so usually there are domains, we would say medical, community, and legal are the big ones, but anything can be a domain. So you can have a social sciences interpreter, or you can have a government interpreter, or you can have a chemistry interpreter even. And a lot of the specific study that they would do would just be around the best practices of that field and that profession. But as far as the ethical core standards of the profession, those are basically the same across domains. So I hope that's helpful. Yeah. And I love this. I love rolling with the questions. We have 3 minutes left, so we probably have time for one more question if anybody has one. And I also want to say that I hope that the conversations you had were helpful, and the prompts about organizational fluency So yeah, if there are any more questions, Anthony, is there anything in the Q&A box?
Nothing in the Q&A box or chat, but and if there aren't questions, I'm curious even if anyone wants to share their experience in the breakouts and if it shed any new light for you as an individual or if anything came up that you might want to share with us. So opening it up.
Thank you. Well, if not, then just you can take those questions back to your leadership and just be like, hey, who's responsible for this? And I hope it's helpful. It was really lovely to meet you all. And I will let Anthony take it away to close out for the day. But I hope to see you all again. We're going to be doing this for, I think, 8 more months or 9 more months, twice weekly or twice monthly workshops on different topics in language access that were determined based on surveying the membership. So these are all topics that matter to you all and from what Welcoming America heard would be most important to you. So thanks again.
Yeah, thank you, Mary Jane. So yes, as I mentioned at the beginning, if anyone didn't hear, this is the final session of Language Access for this month that is open to non-members. So if you are not a member and want to continue that, I encourage you to visit our website to learn more about membership. We'll be resuming this in October. And as Mary Jane said, we're from October. We'll take off the month of December, but then we'll resume again in January through April. And if you are a member and you've gone through our workshops before, we're doing it a little differently, where, as Mary Jane said, we'll have one topic per month, and the first session will be a presentation on that topic. The second will be an actual workshop on the topic. So we'll ask for a little bit more involvement and interaction in that. So we're really excited to kind of bring something fresh to language access as well as some new topics. One, for example, is going to be on AI because we know that's a big thing now. And so we're excited to kind of talk a little bit about how that impacts language access work. But again, those of you that are members, we'll be sending out new links for those sessions. So look for those coming your way soon. If you have any questions at all as a result of today or last week's sessions, reach out to us at events@welcomingamerica.org. Happy to answer them there. And then finally, this and last week's sessions were recorded, and so I'll be sending these out to everyone who has registered, member and non-members. So look for those probably coming out to you in the next few days. So thank you all again for joining. We appreciate your time and hope to see you in October. Take care, everyone.